physical therapist on the internet.
Hi, folks. I'm Bob Schupp, physical therapist.
Brad Heineck, physical therapist.
Together, we are the most famous physical therapists on the internet.
In our opinion, of course,
Today,
Bob.
we're going to answer the question, can your torn knee ligament heal on its own? Big question if you have a torn ligament.
Yeah, you need to know this.
Yeah, so the question is, are you going to need surgery?
Right.
Which is pretty involved. We'll talk a little bit about that later. But you have 4 ligaments in your knee. I'm going to jump right into the demonstration here, Brad. So you have the 2 ligaments on the outside.
Mm-hmm. This one here, and we'll get the kneecap out of the way. The one in here, the inside of the MCL and the LCL
No,
lateral.
that's the outside. That's the lateral.
Oh, that's right. I got the right leg there.
Yeah, they attach the femur to either the tibia or the fibula. So you see the lateral collateral ligament attaches to the fibula. This attaches femur to tibia. Now, there's also 2 ligaments inside, and they cross, and that's why they're called their name. Anterior cruciate means the front cross, and posterior cruciate means the back cross.
Right, so the cruciate means the cross, the anterior, posterior gives you the position, and it's a ligament.
Now, there's only 4 ligaments that, well, this patellar tendon probably helps a little bit too for stability. But
yeah.
they're the main sources of stability. So if you tear one of these,
Ooh.
it's like a 4-legged stool. You've taken one leg out, and
right.
it could really cause instability. Now, my understanding of how this works, Brad, it's very interesting on the body. Let's say you tear one of the side ligaments. The ends can actually find each other and heal.
That is amazing.
Isn't it amazing?
Yeah.
Now, if you happen to tear one of the anterior cruciate or the posterior cruciate, and you always hear how terrible it is to tear your ACL because it can be career-threatening or it can be sport-threatening. The problem with that, there's fluid inside your knee, and those 2 ends, they have trouble finding each other. They float around.
Right.
And
well, they have no muscle in them, so they can't, move towards each other. But evidently, something's going on.
Yeah. Sometimes I think they can find each other, but it's very unlikely. So, usually, as a rule of thumb, if you tear one of the outside ligaments, they will repair it, and you can have a good result. If you tear one of the inside ligaments, I'm sorry, that was wrong. If you tear one of the outside ligaments, they may not have to repair it.
Okay.
They may not have to do surgery. If you tear the inside ligaments, ACL or PCL, most likely you're going to need surgery, especially if you ever want to go back to sports at all.
Right.
Because if you don't do it, your knee is going to feel unstable. And you're going to feel like your knee shifts at time or buckles. I had a friend I had 2 friends actually that never repaired those. And, one ended up with a knee replacement now. I mean, because you're shifting a lot.
Right.
So it's putting a lot of stress on the inside of the knee.
Well, I want to make one thing clear because
Sure.
we're talking about, you may say, you've got a tear in one of your ligaments, but is it a complete tear rupture, or is it just a partial tear and only some of the fibers are ruptured? So that has to be, and they can tell you.
That's absolutely a great point, Brad.
Wow.
I'm amazed at that. So, yeah,
pretty good.
obviously, if they're only a partial tear, they don't have to find each other. They're already found each other.
It's like if these fibers are torn, but they're still connected, the scar tissue is going to, come through.
Bind it together.
Yep, and of course then you got to, treat it appropriately so that it heals properly.
So, if you're going to go back to jumping and landing on the knee, accelerating and changing directions, rapidly pivoting on your knee, which is most sports,
right?
You're going to need to have probably the repair of the ACL or PCL.
And usually it's the ACL, PCL is rarely torn.
I haven't even treated one, to be honest with you, Brad.
I think I had one.
Did you?
Yeah, but it's rare.
So if you opt out of the surgery, you could try a knee brace. You do some physical therapy to try to help strengthen the knee as much as possible. If you decide on the surgery, understand that it's pretty involved. They actually take a donor site from your body or from a cadaver. And or from a hamstring.
Right.
But it's pretty complicated, and the rehab is quite involved.
Yeah, it's
So,
months.
Yeah.
It's going to take months before you can get back to your activity.
So I mean, you can always have the surgery.
Mhm.
You know, you just don't want to not have the surgery and then damage some cartilage because
Sure.
there's been so much shifting in the bone.
Right.
This is where you need to talk to your surgeon. You know, have a forthright conversation
Right.
and figure out what is best for you. And you know, the braces do help to some extent too, but they can protect your knee.
It is probably going
completely.
to be not your standard off-the-shelf brace that you can buy
No, it's going to be one
online,
of
or
those really pricey braces.
where they custom fit it to your leg, and maybe $1,000 or easily
And fairly
more.
big too.
Yeah,
I mean, it's
yeah.
not a little brace. It's in order to brace, it goes fairly far up the thigh, and
Yeah, they make them pretty light though.
Do they?
The expensive ones are like a carbon fiber, or they're nice, but those are the expensive custom ones. And there's a whole topic on braces and how effective they are too. I don't know if we want to get into that.
it's
but.
amazing how the knee is it's a real problem because and that's why I always worried about my son if he had an ACL tear or somebody had an ACL tear. It's just like to me it's like one of the worst sentences you can receive. So, all right, Brad, if you want to check out the rest of this series, by the way, the series
Oh,
on knee
yeah.
pain,
Oh,
go to bobandbrad.com, go to the programs
Programs.
section,
Mhm.
and look for knees. And we got I don't even know how many videos we got yet. 'Cause we
Bob,
didn't-
you
we
never know
finished
how
them.
many we.
30 or
it's gonna be
40.
on 30 or 40. You're not going to look at all of them. I mean, you may, but you just look through the titles of each one. The titles will let you know if that's the one you want to watch. Watch it. And there is a PDF button you can click on and print out a nice PDF of the review of the whole video, exercises, etc. Usually 1 to 2 pages. And then you have that so you don't have to go back and review the
And
video.
you better pull your wallet out and then put it right back because we don't charge you for this.
And you don't even have to put in your email, which
Nope.
is a deal.
Totally frictionless.
Frictionless
Yep.
Exactly, Bob.
All right.
We've been talking about eggs lately.
Be careful.
Be careful is
I
right.
like your line.